what do you think has been the winning recipe to the fact that increasingly we are a quality destination nationwide when it comes to healthcare, and other headlines that have painted a compelling picture of St. Luke's?
Well, I think a couple things. First of all, my experience as a physician has been if you just provide physicians with data and you tell them, here's our problem and here's the data, they'll figure it out. And I think what's been key to our success is empowering physicians. Though some would certainly rightly say that there's bureaucracy to our organization like there is to any. But I think our constant efforts to try to break down that bureaucracy, to try to empower people on the front lines, to try to tell them it's going to be safe for you to try new things. We're not going to punish you for trying something and failing. We want you to try new things. We have to change healthcare. And having leadership and boards that support that notion that let's try some things, and not everything is going to work, but let's try it and let's empower people to do it. Then give them the resources and think about problems in a new way. So, for example, for our approach to postoperative infections, one of the things that in thinking about how people get these infections is typically either bacteria that's on the skin when the operation is made, or it's bacteria that's in the air that settles in the wound. And though our infection rates were very good compared to the rest of the country, they weren't zero. And it was a new line of thinking for us to say, we want to get to zero, but healthcare doesn't have the answer for this because nobody else is at zero. So let's look outside of healthcare. And so we actually partnered with a local company that's actually an international company called Micron that makes microprocessing chips. And the key thing about making these is that any contaminant that gets into that chip during the processing destroys it. So they've got the air quality control so that that doesn't happen. We also partnered with our local university who happens to have an air engineer. And so bringing these folks together, what we looked at is, first of all, we implemented a very good, thorough process for how we clean the skin to make sure we get the bacteria off the skin. Then the question is, what do we do about the air? And we took steps in conjunction with Micron and this air engineer to re-look at how we do things in the OR that would decrease the particulate counts in the air during surgery. And in fact, our infection rates have plummeted since then. So it's that kind of empowerment to think outside healthcare, partner with others. We don't have to come up with all the answers ourselves. And the permission to experiment, try things. And the fact is that healthcare costs are unaffordable. We can't just make tweaks. We've got to find really new ways to do things. In a lot of cases, I believe this is going to be driven by technology because it has in other industries. And frankly, the fact that healthcare is as unsafe as it is in large part because we depend so much on humans. And as long as we depend on humans, there's going to be inherent safety issues because we can't make that perfect decision making. But we can utilize technology in new ways to augment what our workforce is doing to help drive greater safety, greater efficiency, and hardwire processes and make it harder for humans to make a mistake. And those are some of the progress steps that I think healthcare industry is going to have to make if we're really going to make our care higher value, better quality, and safer at a lower cost.